Hello, my name is Shamon Ayala, and I attend Cristo Atlanta Jesuit High School. Today I'll be presenting about zoonotic diseases and spillovers, the dangerous leap across species. First, a little bit about me. I'm a 15-year-old STEM enthusiast living in Metro Atlanta. My vocations lie in the biological sciences. I plan to dedicate my life to be part of the global effort to advocate for the health of humanity through scientific research. My career interests are epidemiology, ecology, biomedical, and civil engineering. I'm president of Cristo Atlanta's Robotics Club, on the leadership team for the Students for Life Club at school, and I'm the networking lead for Bluebird Cured, which is a student led organization founded by my fellow peers in this conference. Together, we advocate for the health of senior citizens. Currently, I intern at a retirement community here. I love making piñatas, learning languages, gardening, reading, running, and volunteering in my free time. All right, now to the science. So, how are zoonotic diseases related to global health and why should they be a concern? Why should we care? Well, zoonotic diseases and spillovers are related to global health and that they pose a threat to the well being of people on this planet. These diseases can spread rampantly, yet they can be prevented if researched thoroughly. With attention to global health trends and communication with nations across the world, we can work side by side for the sake of health. And really, this is what global health is all about. It is a global effort to improve the lives of people. And with the rise of deforestation and habitat destruction, many carriers for potential zoonotic diseases are forced to reside where humans live, thus increasing the risk of a spillover. We must understand the nature of such spillovers to prevent and contain them, or the consequences will be fatal. And in fact, we're experiencing them right now with COVID 19. Here's a staggering statistic. According to the CDC, 6 out of 10 diseases are zoonotic, and this is a cause for concern. All right, but what are zoonotic diseases anyway? Well, zoonotic diseases are illnesses caused by a pathogen, such as a virus or fungi or bacteria. And by the way, for the sake of this presentation, I'll be focusing on viruses. All right, back to our regularly scheduled program. And they can be spread to humans by animals. They have the potential to initiate deadly outbreaks. And for example, the H1N virus that causes swine flu was the culprit of the 1918 influenza pandemic that infected millions of people worldwide. And we can see from this lovely graphic by the CDC just how the spread goes. It goes from animal to human, but vice versa as well. So, what are zoonotic spillovers and how do they start? A spillover is when these pathogens, virus in our case, crosses the species barrier between a reservoir host and humans, causing an infection. And a reservoir host is an animal that simply has a pathogen, but it does not make it sick. And how it crosses from this reservoir host to humans is through mutations in a virus. So usually the virus only has the capabilities to infect the species it's made to do so. But when they mutate, they have the receptors that can bind to human cells, multiplying their genetic code and infecting a human. So human activity can make these spillovers more likely to happen. For example, wet markets and unhealthy agricultural practices, the consumption of bushmeat, and habitat loss and urbanization all contribute to making these deadly outbreaks more likely to happen. So there are methods of exposure. So we have direct contact. For example, if you go and pet an animal that is infected with a zoonotic illness, or you get bitten by one, you can get sick. Or it could be in food. For example, if you consume raw meat or meat that hasn't been cooked properly, you could get sick from it. For example, salmonella. Or we have indirect contact, where you get sick by simply being in the environment or the home of these animals. Or we have vector, where a mosquito or a tick acts like a vehicle that transports a infectious disease from a reservoir host to humans. And for example, we have mosquitoes that bring Zika virus or West Nile and ticks that bring Lyme disease. Or it could be waterborne, meaning that the pathogen from the animal washes up in our drinking water. So let's take a closer look at this in a viral disease called rabies. So rabies infects the brain of a human, and it will kill you if you do not get immediate attention. And the sad thing is that 98 to 99% of rabies cases were caused by dog bites. And many of these victims are in Southeast Asian and African countries. And as we can see here, in the month of June, the CDC recently temporarily suspended dogs from coming into the United States that originate in countries that are high risk for rabies, such as Egypt. And they do this to prevent the passing of these diseases because although globalization is good for our economy and good for humans, it does open the doors for these diseases. And we can prevent them here locally by getting our pets vaccinated and teaching children to be safe around dogs and other animals as a preventive measure. So, as my closing conclusion, we must be environmentally aware when we're planning cities and zoning ordinances to prevent the outbreaks. For example, having a chicken farm, a poultry farm next to residential areas clearly is an invitation for an avian flu outbreak. And we can prevent outbreaks by having hygienic practices in food production. For example, simply wearing gloves, washing your hands, having a face mask, and avoiding raw meats from touching fresh produce can prevent this. And vaccination. For example, here in this pandemic, simply vaccinating people has had a tremendous positive impact in this pandemic and its spread. We are stopping it by having our bodies learn to protect itself against these pathogens. And through epidemiological research, just investigating how do these diseases behave in our environment and what can we do to stop them? What are their causes? And we see this with research by the CDC and the World Health Organization. In addition to epidemiological research, we can look into ecology. We need to understand how this environment works in our ecosystems. What animal might live in one environment may not live the same way in another, and their living habits can affect how we live as well. So we need to take that into account and consider the economic and health impacts of climate change. As I mentioned before, as we destroy habitats through deforestation, we are pushing animals that otherwise would have no contact with humans to be living where we are. And here's the thing, we must understand we are not the only living creatures on this planet. We must learn to coexist and live with respect and regard to other creatures. Otherwise, we will meet our demise. And the thing with wet markets is that we cannot simply close them down because it is a very complicated game, right? To consider that the people who rely on these markets need it for their income to their families. And we need to consider their health in this. It's a really complicated game where we have to tiptoe, and sometimes we don't have a playbook. We must do by trial and error and research. And here are my sources and image credits. And lastly, I'd like to acknowledge the Global Health Leaders Conference at Johns Hopkins University. You guys gave us and many students here a platform to share our research and to share our passion for global health. And I thank you so much for that. And you, the audience, thank you for spending your time to watch this and listen to me speak about this important issue. And to my fellow peers, you are also motivating and inspiring to me. And lastly, Miss Rosie Munoz. Miss Munoz, if you're watching this, I thank you for having an engaging biology class, even in this pandemic. Teachers truly cultivate young minds, and I thank you for that. If you have any questions or just want to talk about science, feel free to contact me on my Gmail. I'm always up for a nice scientific discussion. And this concludes my presentation. I thank you so much for watching and have a good day, night, or evening.